I'm exceptionally pleased to be able to speak with Dr. Jonathon Charlesworth, who's a sports medicine physician in Perth, Western Australia. He works with soccer and with Australian rules football athletes in his practice. He also was a competitor in men's field hockey at the very highest level, having represented Australia on the men's national team, the Kookaburras. So it's a real pleasure to have you here, and thank you for sharing your time and expertise.
No worries. Thanks for having me.
Yeah. Maybe you can talk a little bit more about how you got into field hockey and then later how you decided to become a sports medicine physician.
So my story probably starts with my family and my father. So he was a field hockey player who represented Australia at 5 Olympics and went on to coach our national teams, the men and women, through 3 Olympics. So he basically put a hockey stick in my hand when I was growing up, and I played a lot of hockey with my family in the backyard with my sisters, and then I found that was the sport I really loved, and I continued it through school and university, playing with state teams and eventually getting to represent Australia.
Yeah. What was it about field hockey that you loved?
It's a fast and incredibly skillful game, but really importantly, it's a team game, and I really love playing with other people, and it's a sort of game that's aerobic, but there's a lot of skill as well, which requires strength, and I think it's a really good balance of all those things.
Yeah. And it sounds like over time you had lots of, I guess, different opportunities to play at different levels. Maybe you can tell us about some of your competitions on the national team.
Yeah, so the great thing about hockey is because it's such an international sport, I was able to travel through Europe and Asia playing against a lot of the other national teams. I really enjoyed playing against the European teams, a really tough competition. And then had a great time playing in Asia, even though it's really hot and humid. It was fantastic playing against the incredibly skillful Indian and Pakistan teams. I had a great time playing everywhere I went.
Yeah. What made you decide to get into medicine?
That was a little bit family orientated too. Like my father and my sister were both doctors, and it was something that really interested me. And over time, I learned that it was a very interesting profession. And then over time, I realised that I could actually do it from a sport bias as well, as a sport and exercise medicine physician. And that's something that sort of growing up I didn't know anything about, but it's a growing specialty in Australia and worldwide.
And do you feel, Jonathon, like your background as an athlete or player has helped you in your training or your current work with athletes?
Yeah, absolutely. And probably because I think I had a lot of injuries that help you empathise and relate with patients. And certainly something I've gone through myself is having an injury that has sort of stopped me playing hockey. And that's always useful to bring on my own experiences when I'm talking to athletes about coming to the end of their career.
What injury did you sustain, or injuries did you incur as an athlete?
Lots, yeah. So lots of soft tissue injuries, a couple of recurrent hamstring and calf strains. I broke my jaw, I lost 5 teeth, and I had a bad hip injury related to impingement with a labral tear and subsequent chondral degeneration in my hip. So essentially that's the injury that I required surgery for and stopped playing after.
Was that what caused you to cease your competitive career, injury or other factors?
It was predominantly injury, mainly because I felt like I was playing some of my best hockey at the time that I got injured. We were leading up to the 2012 Olympics in London. I sustained injury at a tournament, a pre-tournament in London, and subsequently played out the years on injections. And then at the end of the year, when I was preparing for the next national championship, I just couldn't tie up my shoelaces anymore. And so I had surgery. It improved my quality of life significantly, but there was probably a bit more damage to my hip than first expected, and that made me rethink the value of doing ongoing damage to my hip.
Yeah. What happened to your hip? Was it simply a matter of overuse, or was there an acute incident?
Both, really. So I had a condition called femoral acetabular impingement in my hip, which essentially is because I had unfavourable bony morphology, which causes an impingement of the soft tissues. It eventually led to a tearing of the labrum, which actually just occurred, with a really meaningless. I remember I was sitting up out of a deep chair and I felt a grab in my hip. And this condition tends to follow the timeline that over time you get increasing soft tissue damage. Sometimes you'll get a tear of the labrum, and that can be very painful. And the surgery revolves around reshaping the bony modelling and stabilising the labrum. But sometimes, unfortunately, you've done some damage to the cartilage already, and that was my case.
Mm-hmm. So it sounds like an invasive surgery. Would that be accurate?
Hip arthroscopy is invasive. I assist a lot of surgeons, so I do a lot of these surgeries as an assistant. And what you have to do is essentially it's difficult to get a scope into a joint, so you need to dislocate the hip to get the scope in. And you don't know about that, obviously, because you're asleep. But it is a surgery. It's a highly skilled surgery. It's difficult to do. And it's the sort of surgery that, it's not a perfect surgery by any means.
Mm-hmm. So when you had this surgery, was that, you said in London, was that prior to the Olympics were you?
No. So I had the injury in London prior to the Olympics, at the Olympic tournament, at the pre-Olympic tournament. And over time, sort of vied for selection, having played on cortisone injections. But unfortunately, it wasn't picked. And then at the end of the year, I had the surgery.
Mm-hmm. Okay, so you tried to sustain your participation by getting cortisone injections, and then in an effort, I'm assuming, to make the team. Is that correct?
Yeah. Yes.
And to what extent would you say that your injury or maybe these injections, were they impacting on your play, on your ability to execute?
I don't think so. To be honest, I played very well on the injections. Not quite well enough to make the Olympic team, but those injections are sort of a necessary evil sometimes for athletes. You need them to get through to the end of the season. Sometimes they will do a little bit of cartilage softening. We sort of know that repeated cortisone injections to a joint will soften your cartilage over time, but we're just not sure how many is the magic number.
Right. And when you get that softening, does that make one more susceptible to injury or more vulnerable?
Yeah, it can. Certainly, we know that repeated cortisone injections will decrease your chondral thickness, so soften the cartilage further. Yes, it can.
And maybe you can describe a little bit about your role now. I mean, it sounds like you've had ample personal experience with injury. Maybe you can talk a little bit about what a day looks like for you, or sort of a normal kind of day. Maybe now it's not normal given the current circumstance.
Yeah, so normally as a sort of a team physician or a head doctor for a team, and I work with soccer and AFL football, which is our sort of national winter sport. What tends to happen is that from sort of anywhere as early as 6 or 7 in the morning, you will have a bit of a plan with the team physio about if there's any players that need assessing, if there's been any injuries over the weekend or through training, make a plan to assess them. Perhaps that will require a trip to the club to do so. Often you'll have players who are injured that need an assessment, and there's often, appointments with, surgeons or other staff that you sort of have to be across. You're often looking sort of at scans relating to, what's been going on with these athletes. And so you probably spend an hour or two just doing this sort of administrative planning work a day. Then my role, I see patients privately in the clinic, and that can be all sorts of musculoskeletal injuries. We do a lot of management for lower back pain, knee pain, all those sorts of sort of chronic injuries. But we do see a lot of semi-professional and recreational athletes who've injured themselves. So my time tends to be divided up into sort of managing the acute injuries of your sporting team, and then the more chronic injuries that you see in clinic. And then I will spend some time communicating each day, and perhaps going to a training or being pitch side for the game, depending on which day of the week it is.
Yeah. So it sounds like you're spending some of your time in your responsibilities as a team physician for, you mentioned the Australian rules football teams and the soccer, but then also in clinic and in private practice.
Yes.
Okay. And maybe you can talk about some of the challenges that an athlete experiences after injury.
So I think there's two distinct facets to athletes that have been injured. I think the first is like mentally, they often find that they have the disrupted routine. They have an expectation about what it means for selection and also return to play. And I think the other challenge is a purely physical one. There are some injuries that have a worse prognosis in the long term. Certainly, if they require a surgery or extended period of rehabilitation, this can be really difficult for them. And so I think that there are those two distinct challenges. But the thing that I've found for most athletes is that they're very good at the physical side of things, and sometimes the mental side of things, they need a bit more support with that sort of building a little bit of resilience around injuries.
Right. And so you mentioned in terms of that psychological component, that it sounds like the primary challenge is really just the uncertainty of the impact on their ability to resume their competitive activity, or the impact the injury will have on things like their skill execution. Would that be accurate?
Yeah, absolutely. And I think there's a lot of uncertainty around imaging, around injuries. Coaches and athletes will often say, how many weeks will it be? As soon as the injury happens, and it's not always clear how people respond to injuries. And so the thing that I found is it's really important to be clear with the communication, and also to make sure you involve the athletes sort of in their recovery, because the thing that I found as an athlete and also working with the athletes is they do tend to get to know their body very well, and what a particular injury will mean, particularly if they've had a similar one before.
Right. So how do you involve the athlete in their recovery, or what does that mean in concrete terms?
So the first thing I'll do is I'll give them my opinion about what the injury is, and talk about it and communicate with them to see if it fits their expectation. And sometimes what I will say is, particularly with working with athletes from Europe, they often will have a different expectation to you. And so it really is meeting a similar sort of biomechanical basis for the injury. Make sure we're on the same page with regard to that. And then also exploring mentally what they think their recovery will be, and making sure those two marry up, because sometimes you'll get a discrepancy with the two.
Mm-hmm. And if there's a discrepancy, does that lead to problems in terms of the recovery or their behaviors in some way?
Absolutely. And I think that when I look back at the injuries that I think I haven't managed as well as I could have, it generally is a miscommunication or on some level a different expectation. And sometimes, in Australia, we have another sort of group of very good athletes. Our Indigenous population are fantastic athletes, but their belief about what injuries are and any sort of surgical intervention are very different to a Western belief. So I know personally from experience that sometimes I've pushed a very Western suggestion about how to manage a disease.
Yeah.
It doesn't fit with their expectation about what it is.
Right. So maybe you can clarify. That's an interesting point, I guess, about how cultural factors may influence expectations. Like when you say kind of a Western framework in terms of recovery versus maybe an Indigenous one, what does that mean specifically?
I think that they often will have ways of managing things where active rehabilitation or surgical options aren't considered necessary. They'll often just go off and rest. And what I will find once or twice, I've really pushed for surgery for an Indigenous patient of mine, and unfortunately, that's not how they see the injury needing to be managed.
Right.
And so they maybe won't go to an appointment, or won't turn up for surgery, for example.
Yeah.
And I found that's probably on my behalf. That's probably a failing of my communication. Is that sometimes you don't think about it from that perspective. That's probably the best example I could give.
Yeah. So would you say that it's important to provide the patient with information or education about the nature of their injury and the progression?
Absolutely. And I know as an athlete myself, even, I played most of my international career as a doctor, but a lot of my state career as a medical student. And even having a, basis in anatomy and injury, I would sometimes not be aware of what my injury truly meant. And I found that the best treating practitioners as an athlete for me would explain very carefully what was required from the injury and the rehabilitation process.
Yeah. And what was the value or benefit of getting that explanation?
I think that many athletes, first of all, feel assured that you know what you're talking about from the first point.
Right.
The information is able to be used by the athlete because they are often very routine based to make a plan as well.
Mm-hmm.
And I think the final thing about it is that it helps them to understand their body better if you are able to be really clear with the communication about what the injury really is.
Right. So if you are able to deliver clear and effective communication, it sounds like it builds the athlete's trust in you as a provider.
Absolutely, yeah.
Okay. And I'm imagining that trust has positive implications in terms of their recovery progression, or maybe their willingness to listen to you, or maybe you can talk a little bit more about how that trust may influence their subsequent recovery.
Absolutely. And I think that the thing I've learned about injury recovery is it's very rarely a linear process. There's a lot of pitfalls. And along the way, sometimes athletes will do something they shouldn't have. And sometimes they don't tell you. And I know myself, I had one or two injuries where I probably did the wrong thing. And that can get you into trouble unless you're really honest about it and work through those things.
Right.
So I think that trust is vital.
And so when you say that they're doing the wrong thing, are you suggesting that they're pushing too hard? Is that the tendency, or they're maybe overly aggressive with their behaviors?
It can go both ways, definitely that, and definitely the other way as well. Sometimes they don't do the required rehab, sometimes because they don't fully understand the injury, and sometimes because, sometimes being injured, you're just not as motivated as you usually were.
Yeah.
I remember my first hamstring injury where I was in a really heavy training block. I'd done way too much that day. I did a gym session, a training session, and some endurance work. I remember I did my first hamstring. And I remember not fully understanding. I thought it would just take time. to get better, but I didn't understand the degree of eccentric rehabilitation I would need to do for that hamstring. And in the end, I ended up re-injuring it twice in the next 3 months, and it put a big hole in my career. And I just remember thinking to myself, geez, if I'd just done it properly the first time, I mightn't have had these problems. But at the time, I didn't fully comprehend how much work needed to be done to come back from that injury.
Well, and again, like I could only imagine that. I mean, when you're working with a patient, maybe that's somewhere, at least in the back of your mind, as you're kind of working with them, like having had such an elite career, but also all these injuries, like, yeah, it just sounds like, or imagine that would kind of impact your interactions with the athletes.
Yeah, I think some of my patients probably don't like hearing about my career all the time and how many injuries I've had, because it sounds like I've injured everything to them.
Right. So maybe sharing too much information on personal injuries has its downsides. But you mentioned the point about motivation, and like sometimes maybe athletes can lose motivation. Maybe you can speak a little bit more to that point.
Well, I think when you are training full time and you have a very set training schedule, as soon as that's taken away from you, you can feel a bit lost as an athlete. Often you're separate to the main group. You're doing exercises that you're not used to in a smaller group with a physiotherapist. You can feel a bit disconnected. And I was someone, I love to train. I just absolutely love training. And so whenever I found that was taken away, I would feel just instantly less motivated, because that's something I really enjoyed doing. So I think there's a lot of athletes that are like that. It can be very difficult to motivate yourself when you feel like you're separate to the main group.
Right. What are some ways? I mean, do you have a role in fostering motivation as a physician, or maybe even other sport medicine providers, or other stakeholders, the coach perhaps?
Yeah, absolutely. I think that communicating with the coach is really important for them, because they often have good relationships with the athletes and have ways of motivating them that you don't.
Yeah.
And so I think it's really important that the coach is aware that sometimes athletes can feel isolated.
Yeah.
And certainly the coach sometimes can isolate the athlete as well, because they're injured and they're not part of it. So that's really important. Personally, I think, and all teams run differently, but the relationship of the physiotherapist with the injured athlete is really vital. They're often more hands-on and day-to-day.
Yeah.
And often you're a bit more of an overseer as a team physician, and it's the physiotherapists who are doing hands-on treatment every day that are really important.
Yeah.
So I think that those are the two people who are really important in terms of helping that motivation with the athletes.
Yeah. And sort of just from your playing experience, or your observations, I guess, as part of that team of individuals working with the injured athlete, are there specific things that you've observed or witnessed that coaches do or physiotherapists do that are motivating for the injured athlete?
Yeah, absolutely. I think the first thing is having a really firm rehabilitation plan laid out by the physiotherapist, or real clear goals with regards to their running or what they're doing in the gym. Sometimes those things, if they're not concrete, the athlete feels less and less motivated.
Mm-hmm.
The next thing is that I think that having discussions with the coach about exactly when return to play is expected, and how that might be, whether it's reduced minutes or how it might be. Having that plan is really important. And I think that there's I've seen a lot of coaching methods over time, and the coaches have to be very balanced but supportive and empathetic of where the athlete is at. And that's, to be honest, that's a very difficult skill. I think it's a really difficult thing to do, but that's one of the things I think is really important.
When you say balanced, in what respect or how?
So I think that the coaches want to get the best out of the athletes. They want them to get the best of their natural ability, but they also have to be part of a team and contribute to a team. And the thing that I have learned is no matter how good you are, you can't play with an injury really. You get found out and the team loses out. So what I do tend to find is the coaches have to be balanced. They can't promise the athletes that they're going to come back and play every minute and be a vital part of the team. Sometimes they have to play a specific role, or they have to, come back in a reduced role. And that can be hard for athletes, but if the coach explains, look, this is where you're at, we think you're going to be great when you come back, but it might take a bit longer. I think that balanced approach is really important.
Yeah. So kind of being, honest about, well, the injury might have some implications for things like your playing time or what capacity you're, working with the team, but also kind of ensure that, the athlete does feel supported, or that, they know that the coach is there sort of as a support or resource for them.
Absolutely.
Okay. You've mentioned a number of times the idea of expectations, and I'm wondering kind of what athletes expect in terms of their recovery, or maybe specifically of treatment providers.
This is really difficult, because I find a lot of what I do, whether it's working with athletes or the general population with injuries, is managing expectations. And that comes from having a good understanding of what the injury is, communicating that to the athlete, and then almost assessing their opinion of that. Because sometimes you will say to an athlete, this is a tendon injury that takes a bit longer. It can be up to 12 weeks or so. And the athlete doesn't hear the part about the tendon issue. They just hear the 12 weeks and they either focus on that, or they go, no, I've done my hamstring before. It only took 6 weeks to come back. And they push and they re-injure themselves. So the thing that I found very difficult is that managing someone's expectations about their return to play or the amount of rehabilitation they have to do, it starts from when you diagnose the injury, when you're talking to the athlete about it, and all the mechanisms that you put in place, talking to the coach and the physiotherapist. And if you get all that right, you can manage the expectation of the athlete very nicely. But if you get it wrong, it's very hard to wind back a patient's expectations. If and particularly giving time frames, I find is one of the hardest things I do. And most of the time you get it right, but once or twice you get it wrong, and there's a problem there.
Yeah. So, I mean, again, I imagine your competence as a physician is important, and you say most of the time you get it right. So being able to kind of accurately assess what that time frame is sounds like it's important in communicating to the athlete, because from what I understand you're saying, once they hear a certain time, then that kind of sticks in their mind. Or if they already have some preconceived notion, like you mentioned, well, 6 weeks, was my last one. So that's kind of what's already in their frame of reference, that getting the diagnosis accurate, it sounds like it's important. And
yeah, absolutely.
And then also, again, kind of that issue, I suppose, of clear communication and sort of outlining the steps. It sounds like that's, valuable in managing the expectation too.
Yes.
And what happens, I guess, if there's a discrepancy between maybe the time frame, like maybe they're initially given, well, it's going to take approximately 6 weeks. But then the reality of it is different, or maybe sort of relative to that normative time frame that they're given, they're a slower recovery for whatever reason. How do you handle that situation?
With a lot of patients, you often find that if an athlete isn't back when they expect to be, they can feel annoyed, angry, all those things. And often you just have to work through that, talk with them about it, be patient, listen to where they're coming from. And it takes time as well to do all that. Yeah. Those situations are always difficult, but they occur every couple every couple of injuries you have, definitely. And sometimes the thing that you reassure the athlete is that spending more time in your rehabilitation, getting back your touch and your skill, and getting back to the level you need to be at, a little bit of that time can be a good thing as well. And it's important not to be rushed. And that's really difficult when it overlaps with selection issues, I find. But that's unfortunately the nature of the beast in these competitive teams.
Right. And excuse me, when you're communicating, I guess, about time and the value of added time, is there some communication about maybe potentially negative consequences of premature return, or not necessarily?
Absolutely. Yeah. That to be honest, that can be a bit of a go-to sometimes when you're trying to manage someone's expectation. You can say, look, we're trying to be more cautious. We're worried about your long-term career, and re-injury certainly.
Yeah. And when athletes get that information, do you find that there's generally receptiveness to it, or kind of how do athletes respond, I guess, when you give that information?
I think it depends on the framework, the past injuries they've had, and experiences of those around them.
Mm-hmm.
Certainly, I know that if an athlete has had a really bad experience with injury and coming back too quickly, they're very receptive to it. If things have always gone very well for them, and there's not those examples around, they're generally more resistant. That's certainly something I don't find I can control all that well sometimes.
Yeah.
But it is certainly something that we're cautious and remind athletes of those things.
Right. Obviously, injury is a physical event, or there are physical sensations of pain. Maybe you can talk a little bit about the nature of physical pain in injury, and also even psychological pain.
Oh, that's a big topic. Yeah, I think it's difficult. Understanding pain theory has improved so much that it can be difficult. The way that I tend to relate to people coming back, certainly from soft tissue injuries, is that a little bit of pain is okay, and that is often your body's way of testing boundaries and learning what it's capable of. But persistent pain or debilitating pain is not something you want. So I often will ask people, to work through sort of 1 or 2 out of 10 pain, particularly related to soft tissue injuries.
Mm.
But with it in mind, they tend to do better if they push themselves a little bit. But what I often find as well is that some athletes will find that if they get any pain at all, they just stop their rehabilitation, and that's not beneficial. So when I talk to people about pain, what I tend to say is you'll probably have a little bit of pain. You can take analgesia and try adjuncts to decrease that. But a little bit of pain is often your body's way of telling you that you're activating the right groups of muscles in your rehabilitation. But it is difficult because sometimes people get chronic pain from injuries, and certainly major joint injuries, people get chronic pain mainly because there is a real issue and that needs to be addressed. So probably in answer to your question, I think it is very difficult for you to globalise pain theory across injuries. Each injury is so different in many ways.
Yeah.
And certainly the thing I've found managing tendon injuries in athletes over the course of a season is if you're able to give them an expectation that this isn't something that will stop them playing, but they might have a little bit of pain occasionally, that understanding for them often leads to really good consequences. They get through, they do their rehabilitation, and they're sort of aware of their boundaries. They don't just stop, because we know that if you stop loading tendons, you run into real problems.
Yeah. So it's interesting. It sounds like you're alluding to this idea of expectations, or maybe even the athlete's understanding, and that impacting their management of pain, or their ability to work through it.
Absolutely, yeah.
Yeah.
I think they clearly understand the injury and what's expected, particularly the soft tissue injuries, and a little bit of pain sometimes is part of your rehabilitation.
Mm-hmm.
They're much better able to deal with it. Whereas
Right.
if you say you're going to be pain-free the whole injury, that's an unrealistic expectation for a lot of them.
Yeah, sure. So is it important for the athlete to be able to distinguish kind of benign pain from more um, pain indicating that there's maybe something more sinister going on, or um, for them to develop that as a skill, would you say?
Oh, absolutely. And I think that young athletes, I see a lot of young athletes, sometimes they don't understand the severity of their pain. They can have really bad injuries with very minimal pain. And sometimes with a growth plate injury, an overuse injury, they have very sort of major pain with something that they'll just grow out of.
Hmm.
And so I think that the education there is really vital. So I'm not sure if that answered your question.
Yeah, it does. I'm curious. Again, you've had a lot of personal experience with injury, and in the course of some of the injuries you experienced, whether it was your hip or I think you mentioned you had a broken jaw. I'm sure that's uncomfortable and painful. How? What were some of the thoughts or emotions that you experienced in relation to any of those particular injuries, or that you see as a physician?
I think probably from I think that when you have a major injury, and I certainly know this when I sort of lost my teeth, broke my jaw, and I did my hip the first time, is that I sort of knew that I was going to have surgery on all those things straight away. I sort of knew. And I think that sometimes athletes, particularly if they have a knee reconstruction or something, they sort of know straight away, oh, this is the bad one. I'll probably require surgery. And that is really difficult, I think.
Hmm.
Um, but there's something about, the sort of the fact that passively a treatment is going to get done to you that's going to make your pain better and help with this injury. That's also useful as well. Sometimes as an athlete, you feel like, oh, I've just got to do everything myself. Sometimes when you have a surgery or things get taken out of your hand a bit, it can help. That can also, down the track, if there's a bad outcome, have problems. But I think that when you first get injured badly and you know that's really terrible pain, I think your thoughts often will go straight, oh, geez, do I need surgery or not? How long is that going to take? What's going to be the outcome of that? It can be very clear that terrible pain has that consequence. But at the
Hmm.
same time, I have athletes all the time who think they've done their knee or are really worried, and misinterpret it, but perhaps sometimes because they have had that injury before, and they require a lot of reassurance. Often they need a scan and some really clear communication about the nature of what's going on with their injury.
Yeah. So it's interesting. You kind of mentioned this idea that when the athlete, if there's the understanding that they do need to have surgery, that there's almost some, I don't know if it's relief or something, that you said it kind of takes things out of their hands, and there's some aspect to that that they embrace. Was that, am I
Yeah,
correct
I
in
think,
that?
well, it's a strange thing because a lot of athletes like to control their environment and everything they do.
Hmm.
But when you're injured, sometimes you just want someone to come in and give you an injection or do something to make you better. And I think that's human nature. I don't think that's just athletes. And so I think that can be a positive thing as well. And sometimes I find a therapeutic thing that I'll do with athletes who are concerned about an injury or not quite sure. I'll send them to get a surgical opinion as well, and often that helps them as well. Sometimes they go, "Oh, that's great. I don't need surgery, but I've got another opinion as well."
Yeah, yeah. So, I mean, I guess, I was speaking with a well-known ice hockey player the other day, and he mentioned that his shoulder dislocated 30 to 40 times. And I was like, well, was that over your career? And it's like, no, that was over the course of one NHL season. And then he had shoulder operation in the off season. And I imagine that the knowledge that, okay, I'm going to have the surgery, and assuming it goes well, as you mentioned, this won't be a recurring thing, but I can recover and get better, that can be kind of a welcome
Mm,
circumstance. And so
absolutely. Yeah.
yeah, I could definitely see that. On the other hand, I guess you mentioned that scenario when maybe the athlete is um, they find out they don't need surgery, and maybe that's also a relief because they think, oh, well, this is bad, and then they realize it's not as bad as they thought. Is that what you were
Yeah.
suggesting occurs too?
Yeah, absolutely. Yeah.
Yeah. Okay. Um, so I guess are there kind of changes or fluctuation in an athlete's thoughts or emotions maybe once they have more clarity about the nature of their injury and what the prognosis is, whether they need a surgery or not? Do those, let's just say the athlete gets surgery, or they're in for an ACL recovery that's 6 to 9 months. Are there kind of fluctuations in those thoughts and emotions that they may have over their recovery period?
Yeah, absolutely. And I think that certainly the ACL is a good example of an injury which requires significant rehabilitation. In the early stages, are very difficult for athletes. But things do get better, and then things will get tough again, and then things will get better. And I think that going through that injury, certainly in athletes I've worked with, and also with friends of mine who have had that issue, it can take a long time, but it does build a lot of character and resilience in them about returning from injury and managing it.
Yeah.
And I've certainly, probably the one surgery that we do a lot of in our AFL, our football here, is shoulder reconstructions, a bit like the ice hockey player you're talking about. And we'll often get them done at the end of the season. And what I often find is that with those surgeries is that athletes often have done it for a long time. They'll have the surgery and they'll think, oh, everything's going to be great again. But they still have to continue the rehabilitation, keep on top of things. And so it probably just sets a new normal for them. And I think that's what a lot of these injuries, these serious injuries that require surgery, even though you have the surgery and you feel like that's fixed all your problems, you realise that you've still got to do everything right to keep on top of things.
Yeah. So, would it be correct to say that it's important for the athlete not to fall into the trap of thinking that the surgery is that quick fix or the sort of, the magic kind of pill that you alluded to earlier?
Yeah, absolutely. And I think, when you realistically think about the injuries we're talking about, certainly I know this with my hip, with shoulder dislocations, with ACL injuries, these all have an added morbidity where they do tend to develop degenerate chondral disease at some point due to the injury, regardless of whether they have the surgery or not. There's really good evidence out there about that. And that's something that I find difficult to talk to athletes about, but is an important thing to talk to them about.
Yeah. Well, I guess, speaking from personal experience in wrestling, I dislocated my shoulder and then numerous times, and then had, I think it was a Bankart operation was the term, and sort of did the rehab, but then I fell into the trap that kind of we've been talking about, and then stopped, I guess, working on that area, and subsequently dislocated it again, and still sort of, I think to this day, a lot of the musculature in terms of like the scapula and feels like it fatigues significantly. And so, I think, that's such an important point about kind of just continuing to, it's a new normal, or you have to continue to do that rehab seems so critical.
Absolutely.
Maybe you've talked a little bit about this, or you mentioned, sorry, that idea about kind of working through an ACL and how it can actually build resilience or kind of greater strength. And one of my questions was, are there any benefits to experiencing an injury?
Yeah, absolutely. I think my experience is that every athlete gets injured at some point. That's part of it. And how they manage injuries affects their brand and what they're like. So that's what I tend to say to patients. I say, look, you're going to get injuries, but how you manage it is part of who you are. And, coaches want people who are, resilient, but also manage their injuries well. So I think that in getting injured can be really informative. You can teach an athlete more about their body, about their expectations about what it is. It also is really useful because it makes them realise how important that sport is. Or conversely, sometimes athletes, they get injured and they realise, I don't really care for this sport, and that helps them with their life decisions as well.
Yeah.
So I think getting injured is a really educational resource in some ways, particularly because every athlete gets injured. You know, it's not something that anyone is immune from.
Yeah.
So yeah, absolutely, and yeah, it definitely builds resilience. It can ingrain some some negative behaviours. Sometimes athletes are overly cautious, or they misinterpret pain, or there are other things. But overwhelmingly, I think being injured teaches you a lot about yourself and your body.
Yeah. And are those two things, learning about oneself and one's body, is that sort of the mechanism by which resilience is fostered, or are there other sort of aspects to the injury experience that can facilitate resilience?
I think that is definitely a main driver about it. But I also think it's about interacting sort of with a rehabilitation program, the ups and downs of it. I think that learning to get through a rehabilitation program is also something that builds resilience.
Yeah.
Particularly when there's ups and downs.
Right. And I guess in terms of those downs, I mean, we've talked about pain, and you talked about things like, or some of the challenges in terms of uncertainty, and are there other sort of downs, or maybe even ups that athletes have to contend with?
Yeah, I think that re-injury is the big one. Really, like realistically, most athletes will get injured, and most athletes will probably re-injure that injury at some stage. So I think that's something that can be really difficult to deal with, particularly if it's in quick succession.
Yeah.
The second thing I think, with regard to what you're talking about, is that sometimes, as I sort of said, people have an injury experience, everything goes really well for them, and so that becomes their new normal. That's what the expectation of every injury they ever have is. But I've never managed the same injury twice, to being exactly the same every time. It's different.
Yeah. Yeah. We've talked a little bit about this, but I want to ask explicitly, what are some of the types of support or social support that injured athletes benefit from?
So I think that our families and partners are really important, and for them to have some accurate information about the injury and what it is really vital as well. And a lot of that will come from the athlete. So communicating with the athlete makes a big difference. Look, it really, this question's really interesting, mainly because it depends on the finances of the team that they play for.
Mm-hmm.
So some teams have immense social support, athlete well-being officers, club psychologists. All those things can be really vital. But I work with some teams that don't have access to those things.
Yeah.
And then you do rely a little bit on your public health system, general practitioners or psychologists to help in the community.
Yeah.
So those are probably, the big clubs, having an athlete wellbeing officer and a club psychologist are fantastic resources.
Yeah.
But not everyone can afford them.
Right. In terms of communication, are there things that can facilitate the athlete's ability to communicate with you as a practitioner or other treatment providers?
Yeah, we touched on trust. I think that's really important. I certainly know that sometimes, because of how an athlete gets injured or their opinion of you, sometimes you don't have good trust, and that makes it really difficult to communicate
Right.
and manage their expectations about the injury. I think that that's a really vital thing. Their opinion of you, how experienced you are. Certainly as a young sports physician, I found that hard. Sometimes I'm looking after athletes that are older than me still, and that's a difficult thing. And then probably finally your past experience. I think that, if you've had an experience as an athlete or, with those injuries, it becomes very clear to athletes quickly.
Yeah. And in terms of, from your standpoint as a practitioner, are there, like, what helps you, I guess, when athletes interact with you in terms of their communication skills and what they bring to their interactions with you?
I think honesty on their behalf makes a big difference.
Yeah.
Sometimes athletes don't tell you everything, and that's very difficult because you can't manage something you don't know about.
Right.
So I think that just the athlete being able to let their walls down a bit, say, hey, look, I'm struggling with this injury, or look, I think I might have done the wrong thing. And because of doctor-patient confidentiality, you generally are the best person for them to talk to.
Yeah.
I think that's really important. And then probably the last thing, I think that a lot of athletes feel like talking to you about what's going on can affect their selection. And I think it's really important that you reassure them that you're independent, impartial, and you just want the best outcome for their injury. That's something I've found very difficult in some of the teams I've worked with, because if a team doesn't have a lot of money, sometimes the coach will act as the club psychologist, the club wellbeing officer, and is really over involved, and that, unfortunately for the coach, it's very difficult, but unfortunately it can have ramifications for the athlete.
Right. So I imagine the athlete may be less inclined to be honest with you if they think disclosing the information to you does have an impact on their selection. Would that be
Absolutely.
accurate? Yeah. And so as part of your communication, is that something that you're indicating to them that, like, I'm interested in just in your kind of well-being, or what you say to me has no bearing on your selection, or how does that work?
Yeah, I think that's it. You have to reassure them about how things sit, and you have to be aware of your contract with the club and also the player's contract, because some of the contracts are about, pretty open disclosure of all medical issues, which, makes it very difficult. And for some athletes, it's big bucks as well, which puts you in difficult ethical positions sometimes. So I've just found with this, you have to be really, really careful.
Yeah. It sounds like, there are multiple challenges in your role as a team physician, I would imagine. Just a few questions, and your insights are great. So, it's a pleasure to speak with you, because I know an athlete who listens to our discussion, I'm sure, can benefit significantly. How do you know, or how are decisions made about when an athlete is ready to resume competitive play?
Generally, it's a collaborative decision. The team medical staff, which is often a physiotherapist, strength conditioning, and the team doctor will often say this player is fit to resume practice. And generally what you'll find is they'll have to get through a certain amount of training under the eyes of the coach to be able to be picked for selection. So that process is different everywhere. Some, most of the time it's 1 or 2 training sessions, depending on what the injury is, but sometimes it's longer, particularly if they're coming back from a big rehabilitation. You get a better sense of where they're at. But generally it's a joint position between the medical staff and the coaching staff and the athletes involved in that. I've had athletes sometimes who train fantastically, coaches keen to pick them, and they've said, no, I'm not good. I don't feel quite right yet. And that's, their prerogative. That's where they're at. They know their bodies, and, everyone's got to be on the table.
Right. So would you say that based on that example, that their physical and psychological readiness don't always coincide?
Yeah, absolutely. I think that's a really good way to put it. And what I would say as well is that sports, particularly team sports, which I'm more familiar with than individual sports, they require really complex decision making. And the thing that I will say is that if you have an injury and you're still worried about it, it can affect your decision making process.
Mm-hmm.
And certainly, to be honest, that's something we've learnt from managing a lot of concussion. That's our big concern, really, is that if your decision-making process is, the best way to say is overworked, mainly because you're concussed or because you've recently had an injury, what you will find is you have a high risk of re-injury. Yeah. So I think it's a really good point you bring up.
Yeah. So how do you, or are there ways that someone, I guess, within an organization, say, for one of the AFL clubs that you work with, are they assessing the mental component of readiness, or is that examined in some way, shape, or form?
Look, I don't think it's probably examined cleanly enough, with any real scientific rigor.
Yeah.
I think it is something that you probably base more on your feel
Yeah.
rather than something scientific.
Right.
And there's some injuries certainly that I've not necessarily managed, but overseen over time, that I've thought perhaps there's a mismatch like you're talking about. So I think that that would be a really interesting tool. I know there are a lot of screening tools out there. I'm not sure if there's a psychological preparedness for
Yeah.
return to sport.
Yeah. So there are,
Mm.
there are a number of, I guess, tools. One specific to ACL. There's another that was developed by a guy named Doug Glaser, who's a physical therapist, and just a short kind of 6-item questionnaire that asks about how confident one is to return to play. But I guess, as with any self-report measure, they're subject to some bias, or maybe if the athlete really wants to get back regardless of how they feel, they can sort of, that can impact their scores. And I suppose the other thing, sometimes, as far as the research goes, and this is an area I'm interested in personally, is what's the meaning of those scores. So if an athlete scores low or high on one of these screens, doesn't mean they're actually more susceptible to getting re-injured or impact their performance. And so I think there's
Yeah.
still more science that needs to be done. But
Oh, that's really interesting. I see where you're coming from with that. That's really interesting.
yeah, I mean, I think, like, and to me, it's kind of like, I think that's exciting, because it's kind of like, well, if you can, if there's consistent evidence saying, well, if an athlete, just as you might say, if someone returns before 6 months, like I came across a study, I think, with youth athletes in ACL, that if they came back before, I think it was 9 months, that athletes under 17 are more susceptible to getting a re-rupture of their ACL than if they wait after 9 months. So, if there's something parallel to that, where it's kind of like, well, if you score above or below this threshold, maybe you're more or less likely to get re-injured. It's kind of that mind-body connection. But anyway,
Yeah.
are there, from your standpoint, Jonathan, are there, or maybe even from the coaches, would there be any kind of observable indicators that maybe the athlete is apprehensive or something, if these screens aren't necessarily used? Are there other ways to maybe assess ambivalence, if you will?
Yeah, personally, I think it's often quite obvious with athletes. They'll often pull out of a challenge when they get back into competitive training, or you'll see they're not 100% in, or they're not doing what they used to do, as bread and butter. Those are the things that I think are most obvious. But I think also you probably rely a little bit on your knowledge of what that person is like as well. And sometimes, that athletes are, need a little bit of a push sometimes. They're naturally very cautious. And so that, I think, is a real skill on the behalf of the medical team and the coach. But I know what you're talking about now with those screening return to sport ones.
Yeah.
I'm really interested if there's soft tissue ones, because they're the ones I find most difficult. I find ACLs, you get a big lead time, so you often have a really good sense for where athletes are.
Right.
Sometimes soft tissue injuries, it can be difficult. So I would be really interested in that.
Yeah. I mean, I think, this one that I referred to by Doug Glaser, I suppose it could be used in relation to different injury types or severities, kind of given the nature of the questions on the inventory. And there's, I guess, 2 or 3 others that assess things like one's sort of risk tolerance, one's confidence, and kind of emotions, I guess. So there are a few tools out there, I guess, that are not necessarily injury specific, that can be used, or that have been shown to at least predict the likelihood of return versus non-return. On that note, I just have a couple questions, and one of them is, in your experience as an athlete or as a sport medicine physician, are there factors that seem to distinguish athletes who make a successful return versus those who are unable to do so, or maybe return at a reduced level of competence?
I think the athletes that are able to push themselves through rehabilitation are very self-motivated, and have a real eye to sucking up the challenge and getting stuck in, for want of a better term. They're the people that tend to do well and recover well from injuries. I think sometimes those who are a bit more passive, not as motivated, don't go out there and really push themselves. And certainly I've had that experience myself with my first hamstring injury. I didn't push myself, and it led to problems down the track. Those are the things that I think you're really looking for. And I always try and say to my athletes, look, treat this as if it's your brand. How you manage injuries is really important. And if you can do this well, that makes a big difference. And so I think if they buy into that mentality and work really hard, sometimes they have to work even harder than they normally would. I think that's a really good indicator about whether they make a successful return or not.
Right. And so when you say treat this like it's your brand, maybe you can just elaborate on your meaning there.
Yeah, so I think that all athletes have a brand, and it's multifaceted. There's strength, endurance, skill, decision making. All those things are part of your brand, but how you manage injuries is part of that brand as well.
Mm-hmm.
So if you're able to provide a really good brand as an athlete, so this is a reliable player who manages injuries well, I think that adds to your value, and it also adds to the team's value. So that's probably what I mean by that.
Yeah.
I find that's a good way to motivate people, because sometimes people think that their worth as an athlete is everything, and injury management's just something that happens passively, and that's what the physios and doctors do for you. But
Right.
you have to actively involve the athlete and talk to them about the fact this is something really important.
Yeah.
And certainly what I've learned in competitive sport is that the best athletes, the ones that never seem to get injured, probably have a lot of injuries they manage very well across the course of their, and you don't think about them because they manage them so well and it's flawless, and they don't get re-injured, and they tend to do things very diligently, and they know their bodies very well.
Yeah.
And that's what I sort of mean by your brand.
Right. So kind of when you frame it as like, creating your brand, or kind of, it sounds like that has implications maybe for how the athlete thinks about their recovery, or maybe would it be accurate to say kind of the likelihood that they are invested or take ownership of it, or you said are kind of active rather than passive? Would
Yeah,
that be
absolutely.
accurate? Yeah. Okay. My last question, if you had one piece of advice that you could share with an injured athlete, what would it be?
I always say the same thing, and I talk about brand a lot with young athletes, but I talk about the fact that when you're injured, your recovery will never be linear. There'll be challenges. It's important you understand that, and part of the journey of going on, the injury journey, so to speak, is that you will learn things about yourself, but don't be disheartened if everything doesn't go to plan.
Yeah. Yeah. And as you mentioned, I guess it's not, there will be those kind of ups and downs, or it's a non-linear process. So, yeah, an openness, I guess, to that sounds valuable. Thanks so much for all your time and expertise. It's been great speaking with you, and yeah, greatly appreciated.
A real pleasure.